Hello, Dr. Vikki Petersen here. I wanted to speak with you today about a condition called fibromyalgia. Perhaps you've heard of it. It's considered an autoimmune disease, and autoimmune diseases taken as a whole are the third leading cause of death. So it's a significant disorder. It affects 2% of the population, so that's twice that of celiac disease that we talk about frequently. And celiac disease is considered a common disorder affecting 1% of the population, so fibromyalgia affects twice as many people. 90% of the people that fibromyalgia affects are women, so it is skewed that way. There seems to be a hormonal facet to it. Now the symptoms include muscle pain, joint pain, trouble sleeping, fatigue, depression. So it's something that can be quite debilitating and really affect someone's ability to really live life to its fullest and enjoy their lives. Now there's really no cure for it according to traditional medicine. There are some medications for it, none of which are doing a great job treating it and have some side effects that are worse than the problem itself, actually. But I wanted to talk to you a little bit about what we see here at the clinic and the success we have, because we do have very good success. There definitely seems to be a digestive component associated with fibromyalgia. In fact, a study showed that 73% of people with fibromyalgia have irritable bowel syndrome. Now, irritable bowel syndrome is demonstrated by someone who has diarrhea, and then it goes back to constipation, and their bowel is inflamed, and so it's a very digestive problem, and that's the hallmark, and people are very uncomfortable, it's painful, they have gas and bloating. And even though digestive complaints aren't a hallmark of fibromyalgia, there is this strong association of 73% of the people with fibromyalgia were shown to have irritable bowel syndrome. That kind of harkens back to what we've learned about the digestive tract. It's called the second brain for a reason. It's extremely important as to how the body functions. And when the digestive tract is not functioning the way it should, a leaky gut, food sensitivities, then you have inflammation that then leaves the digestive tract and travels throughout the rest of the body, and certainly pain and fatigue and trouble sleeping are very common associations secondary to food sensitivities. IBS is very associated with gluten intolerance, so I'm painting a bit of a picture here, so follow along with the string. IBS is highly associated with gluten intolerance, and IBS is highly associated with fibromyalgia. So you probably see where I'm going here, but point in fact, a research study showed that 9% of patients with celiac disease had fibromyalgia. So that is a very high association. So what we have here is an interesting underlying root cause of potentially a digestive tract that's not functioning exactly the way it should, and gluten intolerance being the leader in something that's really causing that small intestine to not function as well as it should. Interestingly enough, similar to celiac disease and gluten sensitivity, when it starts later in life, so in adulthood, in other words, it didn't start in childhood, there seems to be in fibromyalgia a traumatic event, something that's sort of a demarcation line between I was fine to now I have fibromyalgia. That's very similar in celiac and gluten sensitivity, where patients state, I was fine, I ate gluten, it didn't bother me, and then blank, something occurred, and then I couldn't tolerate it. So they have that similarity in the diseases that I find fascinating. And sure enough, in our experience, the patients we've treated with fibromyalgia did have a food sensitivity, gluten being primary amongst those. Also, we've talked about in the past some secondary effects associated with gluten intolerance, where we have the damage to the small intestine, potential infections in the small intestine, adrenal gland imbalance. I know I'm going over a few things here that if you've never seen me speak before, these are new, but feel free to go back to some older YouTube videos and find some more information if you'd like. But The secondary effects of gluten intolerance involve making sure the immune system is strong, healing up any infections in the small intestine, normalizing the hormones. And so this is interesting because remember, 90% of the people that suffer from fibromyalgia are women. So there definitely seems to be a hormonal component there that maybe men with their higher testosterone have more of a protective effect than women do. And adrenal gland, which is your stress gland, being stressed and not functioning the way it should, malfunctioning, is very associated with hormonal imbalance and is also a very common secondary effect to gluten intolerance. So, in a nutshell, what we have here is that our successful actions in treating patients with fibromyalgia, and we have had great success, is identifying if they're having a food sensitivity or intolerance, and as I said, gluten is chief amongst those, really healing that small intestine, whether they have digestive symptoms or not, because much like celiac or gluten sensitivity, you can have absolutely no digestive symptoms, yet you're being affected by gluten. So, we check to make sure that that small intestine is healthy. If not, we get it there. We normalize hormonal imbalance, look for any potential infections or toxins. And that, in a nutshell, is the treatment protocol. And it works very, very well. And with fibromyalgia affecting so many millions of women in particular, I just really wanted to let you know what we were doing and that it was working well. So please tell your friends or family, anyone you know who's suffering with this disease, about this treatment protocol, and feel free to ask me any questions that come about after having watched this, and do let me know what I can do to assist you. Until next time, I wish you very good health.